Well, of course, we know that aging and sometimes chronic illness can be facts of life, but it's not easy to see a loved one going through that. But making sure you have good help to make great healthcare decisions really is a key, making all the difference.
And it's really not just as we age, but at any age. So today we've asked Dr. Daniel Maison from the Spectrum Health Medical Group to come in and talk about palliative care. First of all, can you tell us a little bit about it? What is it?
Sure. What palliative care really is, the two main things we end up doing for folks are helping folks when they have really difficult or challenging to treat symptoms such as pain or other distressing symptoms. And we're also often asked to come in and help folks navigate really challenging or difficult medical decisions. And so those are the two main things we do in the work that we do at Spectrum.
How are you different than hospice? Because it sounds like so many of the options that are presented to patients through palliative care are similar to what you may receive in hospice.
And that's a really great question. I think the big thing to start with is that we're much more similar than we are different in terms of that. But the main thing that separates palliative medicine from hospice care is that we can provide palliative care at any point in somebody's illness. Whereas hospice is really for when you're getting towards the end stages, the last 6 months to a year or so. Palliative care can happen any time when somebody has difficult to control symptoms or any challenging decision. And just to share with you, the most varied day I've had since I've been here in Grand Rapids is the day where in the morning I saw a 25-year-old, and my last patient of the day was 104.
Wow, really?
The same day, yeah.
That's amazing.
Wow.
All, of course, with very different needs, but we're able to help both of them in different ways.
You know, why is this so important? Is it because people are living longer? Is it because there are so many diseases that connect, if you will, or lead to other diseases and problems?
That's a great question. I think really it is that we're actually able to live much longer now, which is wonderful. The flip side of that is we're all now living with chronic illnesses much longer than we would have 50 or 100 years ago.
Right.
The choices people are being asked to make are incredibly complex. The technology is exploding at a wonderful rate, but as things become more complicated, what we ask patients and families to navigate through becomes more complex every single day.
You know, and it's interesting, it just kind of strikes me because I know we're kind of a mobile society, and I'm guessing that for patients who have loved ones nearby, it may be great to have that person as a sounding board, but maybe you're here by yourself, maybe you don't have that great infrastructure. It sounds like you and your team can really help people who may be sort of on their own facing decisions.
It's really true, and oftentimes one of the things we do is help kind of families sort of reconnect. So we know now that kids are spread to the four corners of the country and all, and if people are lucky enough to have a family nearby, that's wonderful, but as you say, many folks have folks sort of scattered around. And so oftentimes when you're talking about decisions of this magnitude, the whole family needs to be involved, and so we'll often help facilitate a conference call or have kids kind of fly in so we can talk about these things as a family.
You brought up a really interesting scenario. You have families spread out. Even if you have family here, I feel that more and more that the medical system has become so difficult to navigate. Even if you have family members that are, you know, pretty able to kind of attend meetings with doctors and things like that. Do you feel that that is something also that you can help a little bit with because you have that expertise?
Oftentimes what we often do is, of course, the folks we see tend to be some of the sickest people in the hospital.
Sure.
So they won't have one or two doctors, they might have 6 or 7, all doing a great job at their particular areas of expertise. Sometimes families really appreciate having somebody come in and help sort of tie that all together. And help again sort of navigate these incredible complexities that they're faced with.
Yeah, so many different options for patients, and you know, to sort it all out for people, you actually have a web chat coming up where people can connect to you online. Tell us about that.
Yeah, we're actually going to be inviting folks in the community to come in and actually write in questions they have about what we do and how we can help them. So we're really excited about that.
So really anything, you're talking about a pretty wide scope here with palliative care, that you know, just from the ages, I never really dreamed that you were treating people in their 20s, you know, all the way up to their 80s. That is a wide scope, and it really keeps it wide open for a lot of people out there who might be saying, I need some help.
Yeah, it's really true. And part of that also is we're such a brand new specialty. It's only been recognized as a subspecialty since 2006.
Oh, okay.
Now, obviously, a lot of folks have been doing this kind of work for a long time. And if you talk to, you know, looking at what doctors were doing 100 years ago, probably 3/4 of what they did was palliative care in a lot of ways. But as technologies have advanced and we've become more specialized, it's something we've sort of rediscovered recently in the last 10 to 20 years. So.
Well, it's great. And, you know, here in West Michigan, we're just perfectly centered to be able to take advantage of all the new students coming in and all of the just great medical facilities that we have. So thank you so much for being here with us today.
Thank you.
Yeah, so informative.
Appreciate it. Thanks so much. I appreciate it.
We'll be right back.
This is 8 West.